we're all still grappling with the weight of the COVID-19 pandemic. And with regards to breast cancer, which obviously in wealthier countries is typically detected through screening mammography, we've had to have a real change in the way that we approach mammography during the peak of the pandemic, as well as the way in which we manage breast cancer when we were trying to avoid excessive patient contact with hospitals and clinicians at the beginning of the pandemic. So we have this kind of brave new world in which, one, we have patients who we are recognizing were originally screened for mammography, didn't get it, and it's not clear yet how many of them have made their way back to screening and what the implications will be for those who did not. And then two, we started a lot of people on neoadjuvant systemic therapy, both endocrine therapy as well as chemotherapy and immunotherapy in the early part of the pandemic in order to avoid unnecessary or at least surgery that could be put off, given that there might be other resources required to manage COVID-19 cases. And so as a result, we also have a large cohort of women who received neoadjuvant systemic therapy who might otherwise have had surgery first. And in particular with neoadjuvant endocrine therapy, that represents a group that may be much younger and healthier than our traditional cohort of people who get neoadjuvant endocrine therapy in the United States, where it's often used as a temporizing measure in older women who may not be able to tolerate chemotherapy. So I look forward to hearing updates from the people who are providing kind of the contextualization of breast cancer management within COVID-19, and also the people who are discussing how disparities have been exacerbated by the COVID-19 pandemic and what we are obligated to move forward, recognizing that the practice pattern changes brought about by the COVID-19 pandemic with regards to screening, as well as neoadjuvant systemic therapy, have the ability to exacerbate existing disparities and what we need to do going forward.